Did you know that medroxyprogesterone doesn't just come as a shot? While most people know it as a Depo-Provera, the 3-month birth control injection, there's also a tablet form, and it's used for a whole different set of reasons. Hi, my name is Stan, and I'm a licensed pharmacist, and today let's break down medroxyprogesterone. Depo-Provera is a synthetic progestin, mimicking the hormone progesterone. In its injectable form, it's used for long-term contraception with a 150 milligram intramuscular injection given every 12 to 13 weeks. It's one of the most effective birth control methods available, over 99% effectiveness if used on time. But if you're not looking for birth control and more need help with menstrual irregularities, endometriosis, or hormone replacement, that's where the tablet version comes in. The oral tablet, sold under the brand name Provera, is most commonly prescribed for abnormal uterine bleeding, absence of periods, also known as amenorrhea, and as a part of hormone replacement therapy in postmenopausal women, which is usually paired with estrogen to protect the uterus. Dosing typically ranges from 5 to 10 milligram daily, taken for 5 to 14 days per cycle, depending on what you're treating. For hormone replacement, it's often prescribed cyclically, for example, 10 milligram for 12 to 14 days of each 28-day cycle. Side effects of the tablet form are similar to that of the injection. Think nausea, bloating, breast tenderness, headache, and mood swings. Some people notice changes in their period, meaning it's lighter, heavier, or sometimes even spotting between cycles. One key difference, the tablet doesn't affect bone density the way the injection can. So if you're worried about osteoporosis, the oral form might be a better fit. However, the oral version isn't used for birth control, so don't confuse the two. And regardless of the form, medroxyprogesterone is processed by the liver, meaning it's not recommended for people with severe liver impairment. There is no formal dose adjustment needed in kidney disease, but caution use is advised in patients with multiple health issues. And then one more warning, medroxyprogesterone should never be used during pregnancy, and the injectable version carries a black box warning for potential bone loss with long-term use, defined usually over a 2-year period. That's why regular monitoring, especially for teens and postmenopausal women, is so important. So whether it's a shot or a pill, medroxyprogesterone is a powerful tool in managing both birth control and hormonal health, as long as it's used the right way. Thank you for watching this educational video. If you found this helpful, please like, subscribe, and share it with someone who might need it. Stay healthy, and I'll see you next time.